What's up, Z-Pack? Come on in, I'm live. YouTube of all things. What? I like YouTube sometimes because y'all are smart. Let me get up your comments here. Remember, for people who are watching this on the replay, YouTube does a weird thing. They actually take the live comments and partition them off in this weird little chat box. So if you want to see what was discussed during the live show, definitely click the little chat box thing so you can see it scroll as you're watching the video, and then you can leave comments on the video after it's been live, and I look at those comments as well. So let's get into it, fam. Woot woot, said somebody. I'm gonna pull up your comments. Josette is here, Ashley's here, Carrie Bennett. These are all my Facebook supporters. If you guys aren't part of the Facebook supporter tribe, you're high, all right? Or you're not high, whatever you like. You need to come join us there because we have the crazy discussions. It's much more free form, less uptight. Although this is not very uptight. So come on in, guys. Okay, today what I want to talk about is something that I think relates to the current struggle we're having discussing Medicare for all and healthcare reform in this country. And it has to do with fixing what's primarily the fundamental broken piece, which is prevention, primary care, actually keeping people healthy so they don't require expensive medical services. So the goal is to do things for people so you don't have to do things to people. And I think there are actually bright spots and solutions for how we can fix primary care, and they actually inform how we can actually pay for healthcare across the board in a way that actually empowers both the caregivers, doctors, nurses, nurse practitioners, PAs, et cetera, and patients to actually innovate, have the time and the tools and the resources and the autonomy to actually do healing, because a lot of healing is actually relationship based. And we've been so reductionist in our modern assembly line model of primary care. Oh, you're depressed? Here's a pill. Oh, you have hypertension? Here's a pill. No looking at the actual root causes of depression and hypertension, whether they be loneliness, whether they be stress and cortisol release, poor sleep, substance abuse, a million myriad of things that have to do with social determinants of health, like living in a food desert, not being educated about not drinking sodas and calories, and having 7-Eleven be the easiest and cheapest source of food. Those things are never addressed in our current assembly line culture, where we have to see 30, 40 patients a day. We're paid by RVUs, relative value units, which are basically a function of, like, you got to see as many patients as possible and do as many procedures and churn volume in order to actually generate a paycheck. That's the exact opposite incentive that you want for a doctor to keep you healthy. So the question is then, what is direct primary care? How does it solve these problems? Isn't it just concierge medicine, et cetera? Let's read some comments. Brock M., what's your advice on patients who are non-compliant, helping them to understand they need to stick to their prescribed medication regimen? We're going to answer that through our discussion about direct primary care, because it has to do, spoiler alert, with relationships, with understanding the motivation of patients, understanding what their goals are, and then connecting with them instead of dictating at them or lecturing at them or prescribing at them. You have to have a partnership, a sort of a shared decision making. And to do that, you need time and resources and incentive to do that. And currently in primary care, we have none of those things. So we spend 5% of our healthcare dollars on primary care, and we have the worst outcomes in the developed world because we're screwing it up. It's all backwards. We have a system where we have more specialists, stuff that's done to people, than we have primary care docs. And the specialists actually agree with this. They'll say the primary care docs are garbage. They're not actually doing anything. It's foisted on us. We end up having to cover our butts and do procedures and all that. And actually, we just want to practice at the top of our license, seeing stuff that matters. We want partners that are going to do the quarterbacking on the primary care stuff. And we're not having that because our system isn't encouraging that. And that's true across the board. It's not just private practice. It's big systems like the Kaisers and the big integrated systems where the volume requirements are high, where productivity requirements are high, where we're staring at a computer the whole time instead of at our patients, where we're going home and charting, and the bureaucratic spread is so big that we can't get anything done. And of course, trying to bill insurance means another layer of complexity, another layer of having to game our visits to make sure we get paid. It's absolutely the stupidest thing in the world. And see, look at, so what Satchel Dunn says, hey, most of us have been to health class, doc. We know soda is bad. Do you? So if you saw any of the patients on a daily basis that we see, they have no idea that drinking, whether regular cola or diet cola, is bad. They are putting Dr. Pepper, sugared Dr. Pepper, in bottles and giving it to their babies, okay? And you're telling me they actually know this, that you've been to health class? That's bull fucking shit. They don't know this. And why? Because we don't educate people properly. They don't know it because we drop the ball as a society. We drop the ball because there's such a big inequity between people who are educated, who have money, who live longer because they're educated and they have money, they live in the right zip code, than people who don't. And in this country, we deny the social determinants of health. Now look, I'm not some fucking communist. I don't want to socialize medicine. I've told you that already. What I'm saying is we can do this in a uniquely American way to actually connect with patients, to teach them, and to have them teach us in a collaborative way. And so let's get into direct primary care. So direct primary care says, okay, what's broken with primary care? We don't pay for it properly. We go through an insurance middleman, which is dumb. And I'll tell you why that's dumb. Do you take your car to the mechanic for an oil change and a tire rotation and a 30,000 mile service and then go bill your insurance? Could you imagine what it would be like, how long you'd have to wait, how inflated the prices would be, and how much paperwork you'd have to do and how much money you'd have to spend on insurance premiums to have, repair, maintenance insurance for your car? No, you pay for that out of pocket in the hope of preventing a catastrophic accident or breakdown that's going to invoke your real insurance, which is what insurance is. It's for catastrophes. Why is healthcare any different? In healthcare, it should be paid for differently for prevention and primary care than for catastrophes. Right now, we all go through the health insurance. Health insurance is a dumb way to pay for primary care because it doesn't pay enough to the caregivers. It forces a ton of paperwork. And now the primary care docs are staring at their computer trying to please a goddamn insurance company. Some fucking bean counter sitting somewhere who's a good person is doing what they're incentivized to do. And they're doing that all day instead of actually going, hey, why do you put Dr. Pepper in your bottle for your kid? Let's talk about that. Let's talk about everything around that, because that's what's going to prevent that case of obesity, diabetes, childhood fucking hypertension that we're seeing now. This is disgusting, you guys. It's like we live in the third world in terms of our outcomes for maternal mortality, for, more people are dying of diabetes and strokes and heart disease and the complications of our stupidity than they are of terrorism. And we're freaking out about terrorism and bombing countries into the Stone Age. We don't even fix our own shit. We've gone to war for less than we've done to our own goddamn people with our healthcare system. It's crazy. So then you wonder why people unplug from the matrix. And this is what we're talking about with direct primary care. So direct primary care says, listen, by the way, just a quick thing. I no longer give a fuck. I'm going to say exactly what I think, okay? Nobody pays me to see patients. I see patients for free at our county hospital in Las Vegas. And if they want to fire me, then they lose free labor. I don't give a fuck what companies who want to sponsor the show or who want to have me come speak think about what I'm saying. I don't give a fuck. If I suddenly have no career, no livelihood, you know what? I've saved up a little money. I can live at a subsistence level. My wife's a doctor. My goal from now on is to tell you guys exactly what I think with no filters. And a lot of people are going to agree. A lot of people are going to disagree. But the one thing I promise you is I do not give a fuck what anyone thinks. You know what? I was doing a talk recently and they tried to censor me in the talk. They wanted me to delete slides. And you should have seen the fucking email I sent. I was so pissed off. I'm like, you don't tell me what to say. And this is the problem with corporate medicine. This is the problem with us getting butt fucked constantly by people who have never touched a patient. Never touched a patient. all right? And they're trying to design health policy and business policies around this shit. This is why things like direct primary care emerge, because they take the bullshit out of the equation and they go back to the primary situation, all right? So, back to direct primary care. I'm sorry, I get a little bit fucking pissed. All right, so what direct primary care is it says, okay, you're not paying for it right, you're not paying for it enough. Take insurance out of it, pay directly, hence direct primary care. And either the patient can pay a monthly fee, or an employer can pay a monthly fee, or fuck it, if an insurance company wants to pay a monthly fee that's at the appropriate level in exchange for amazing primary care, that's what we did at Turntable. That can work too. So again, the most direct primary care docs are independent docs. They don't want the insurance hassle, but you could do this. You could also go direct to a self-funded employer, someone who's paying their own medical bills anyways, like, you know, an Amazon or somebody like these big companies. Even smaller companies often directly pay for their healthcare. And say, you know what, we're gonna carve out primary care and we're gonna pay $50 to $70 a month for unlimited access with no copays to amazing primary care. And in exchange, this is what the primary care doc does. They keep their panel sizes lower. So that means that instead of like what you typically see at, say, at a Kaiser or one of these bigger corporate medicine entities, you know, 3,000 patients on a panel. Now, you know, you can do a lot with telehealth and other things and with a team, but 3,000 patients on a panel is fucking stupid. You are not going to provide good quality care. I don't care who comes at me about that. 3,000, 4,000 patients on a panel, you are not going to do what needs to be done to prevent disease, period, unless you have AI doing most of the work, which we don't yet. So what would a direct primary care doc do? Have a panel of 500 to 1,500 patients and still make the same salary, but provide tremendous care. And by tremendous care, it means 24/7 access. And it turns out patients actually don't abuse this when you form a relationship with them and you do most of the care in the visit. You take time, 30 minutes, an hour, whatever it takes, easy access to the clinician, all that other stuff, especially if you have a team-based model like we had with Turntable Health, where there are health coaches, social worker who does the behavioral health stuff, pharmacists, a whole team that can be involved and do the heavy lifting, relationship building, motivational interviewing, looking at shopping lists, text, email, Skype, phone, whatever. You know, you can have patients sign a HIPAA waiver saying, I'm okay with communicating by Skype. They can sign that. Now, again, don't quote me on this because I believe that's legally true, but I don't give a fuck because the patients actually want this, all right? I am so fucking tired of people using HIPAA as an excuse not to innovate. Maybe we need to overthrow HIPAA. Have we thought about that? Maybe it's just having the wrong effect than what was intended. All right, back to this whole thing. So this is what the fuck is Satchel Dunn keeps saying with all caps? Okay, you want a damn secretart. What the fuck? I don't know what that means. Are you hiring is the next thing, Satchel Dunn. I'm starting to like you, Satchel Dunn. All right, back to this lecture, whatever it is. All right, so yeah, Satchel is a troll. Fuck him or her or whoever he is. All right, so here's the thing. In this setting, the doctor or the nurse practitioner or the PA, whoever's doing this shit, right? Usually it's a doctor for direct primary care. Maybe working in a team with collaboratively with nurse practitioners and PAs, because that's the best structure for that. Unless you're out in the rural somewhere and there's no doctors, the best structure for that is working in a team where everyone's practicing at the top of their training. Flat fee, all you can treat access to the buffet of primary care. And they can then, for people who are paying out of pocket, pass on cash pay prices for labs, for imaging, for generic meds. They can do a lot of innovative things. Then they form, so the question is, what do you do with specialty care? So, well then, and by the way, same day appointments, right? You're not waiting, really high touch care. It's like concierge for the masses because it's not that expensive. It can be as low as $40 a month for healthy people. Now, here's the thing. What do you do with specialty care? Well, specialty care, what these doctors often will do is form a de facto good guy network by finding the specialists that don't suck, that communicate well, that collaborate with really good primary care, and that provide cash pay prices for patients that, say, don't have insurance or who have high deductible plans where they're effectively uninsured, and navigate through the system. That's what we did at Turntable. It was transformative, you motherfuckers. I'm telling you this. It works. It's a bright spot. It's a solution, right? And it doesn't have to just be independent direct docs doing this. It can be multi-specialty groups where you carve out primary care in the same way and it's integrated into a network of specialists and you have an EHR that ties it together. Speaking of EHR, a lot of direct primary care docs have unique bespoke EHRs, or they're using EHRs that are purely for keeping records and taking care of patients, not the glorified cash register that EHRs are used for in all other billing purposes. Billing insurance is the stupidest fucking thing in the world. And people who want single payer don't realize you're just billing another insurance company. So it's the same thing, right? It's so painful. We have legions of coders and billers who have to siphon through this, and that's a 30% administrative overhead. Now, one advantage of single payer is at least there's one insurance company to fuck you in the ass. Just one. So at least you know you're going to take it in the butt this way, it's going to hurt this much until the next Congress comes in and changes all the laws, and then you're negotiating with, I want you to put the dildo in this far in my ass instead of this far. That's what it's like, guys. So, all right. So say you disintermediate primary care from that insurance bullshit. So how is that going to scale? And I'm going to take your questions after this. How is that going to scale? How are you going to pay for that? How does that involve universal coverage? Here's how you do that. Universal coverage you can do very simply. Here's a plan that Ryan Neuhoffel, he's a direct primary care doc, he's going to come back on the show to talk about this, came up with, and I'm not doing it justice, but it's basically something like this. You get catastrophic insurance, all right, either through the employer, from a private insurance, through Medicare, if you want to expand it, but it's catastrophic. It has a very high deductible. And that deductible can be subsidized if you're poor. It can be subsidized by your employer so that if you need catastrophic care, you can get help for that. But within that deductible, you get a personal savings account. And that means either the government or your employer or you put money in this account, and that money is used to pay for direct primary care. You're paying for the preventative services out of a subsidized account, and that subsidized account is used to keep you out of having to spend your deductible on catastrophic care unnecessarily. And the entire system's costs start to shrink because we're not throwing a bunch of money at unnecessary procedures and unnecessary tests, because everybody has skin in the game. People don't want to waste their personal savings account or their deductible on unnecessary shit. The direct primary care docs are all competing to innovate to provide the best care and service for that money. It's fucking American as apple pie. And then if there's trouble, you never go medically bankrupt because you have that catastrophic insurance or Medicare for all catastrophic for everybody. You only need to raise taxes a bit, and that's going to be compensated by all the savings in the $3.5 trillion of healthcare that we're going to start to contract. Who's going to lose? Well, you're going to need less hospitals because you're going to have less admissions. You're going to need less specialists because you're going to have less unnecessary referrals and less testing and less caths. And you're going to need less basically infrastructure because you're going to kind of start to contract what you don't need. You're going to expand primary care. Primary care is going to be sexy as fuck. You're going to transform medical education to make it focus on these sort of preventative, holistic ways of taking care of people. And you're going to pay for people's medical tuition because if they do primary care, period. Because then you're incentivizing more people to do primary care. You're getting the best and the brightest going into primary care. People who want to do specialties, for whom that is their calling, they will get to do that, and they will still make money and do all that, but there will be fewer of them. And that's just fucking the way it's got to be. There's no other solution that doesn't butt fuck us. There's no other solution that doesn't bankrupt us. There's only that. And the direct primary care model is just a part of that. It's a model that can work in many instances, and it involves telling insurance company and government to get the fuck out of the doctor's office. Let us take care of patients, and we will do well financially. If we do good for patients, we will innovate. And if we don't, people will vote with their feet. They'll go somewhere else. Employers will vote with their feet. They'll go somewhere else. If we're spending a ton of money on downstream care, if our patients are unhappy with the service they're getting, because that's important, fucksticks. The patient experience matters. We denied on the health, oh, we're not a hotel. That's true. But we should provide amazing care. They should feel like they're getting care. This is a goddamn shamanic ritual we do. It's not just this reductionist, let's give meds. It's a ritual of caring and being cared for, and that connection that actually drives a lot of quote unquote healing. Aren't we here to heal? That was the idea. What the fuck is Satchel Dunn saying? Okay, let's read some real comments. God damn it, can I just turn that person off? How do I do that? Hide user, there we go. All right, now we don't have to look at Satchel anymore because they're just being distracting. And I hate all caps with a fucking passion. Okay, AK Medic 49, did one of your med techs come up with this? Because it actually sounds like a great idea. It's probably an idea that came up from a team of people, right? Because we should be working in teams in healthcare. We have to get nurses off the computer and at the bedside, DJ Prim 3. Bingo. Why are they at the computer? Because it's cover your ass medicine to help bill. Take that off. Everything should be focused on the patient. If the computer helps the patient, you work on the computer with the patient together. It's their record. We're just the stewards of it, right? Fucking shit. How is this rocket science? Why do I feel like Kramer from Mad Money? Daniel Sauerborn, a real doctor. Doctors are overwhelmed by bureaucratic nonsense, which increases overhead costs and causes burnout. Bingo. Moral injury occurs when we treat a computer screen, when there's a patient sitting in front of us. All right? The other thing that causes moral injury is the fact, and this is going to piss people off, but Daniel will appreciate this. We talk about mind and body. We should be also talking about spirit. What do I mean by spirit? This connection between humans and a feeling that there's something bigger than us. It doesn't have to be God, but there's a connection between conscious entities that we ignore, we reduce out of existence in our healthcare transactions. And that's what they are, transactions. They should be relationships between conscious, feeling, loving creatures. And that feeling of being cared for has disappeared. Bring it back. Why has it disappeared? Because some goddamn MBA got between us and our patients. You know, there was a Twitter spat the other day. A doctor was basically saying, blah, good God, this is the thing about MDs, and you got to be an MD, and said some shit. This MBA, whose description was, I'm a healthcare consultant, said such and such MBA, said, hey, that comes off as really arrogant. You should be more humble. To the doctor, female doctor. Well, some fuckstick with a business degree is telling a female doctor to watch her tone when she talks about her profession. Fuck if that isn't the fucking central cause of all our shit since we mechanized medicine and turned it into a business, since we sold out to corporate bullshit. Fuck that. Do you understand how corporations work? I have been in the midst of this so many times. They think in a way that's so foreign to delivering actual human care. It's not their fault, it's how corporations work. Until we revise how corporations work, corporate medicine is going to be bullshit. It's the people on the front lines that are delivering the care. Everything else should support that. Right now, the people on the front lines delivering the care are supporting these fuckstick MBAs who sit there. They're good people. They think they're delivering value. They are parasitic leeches on the tit of the work of the frontline medical professionals. Let's be completely honest. Let's not lie about this shit to ourselves. We need clinician leaders. Yes, we do. But they need to serve the patient. All right? And yeah, you need to keep the lights on. There are ways to do that while serving the patient, which means supporting the caregivers. Direct primary care is a way of saying fuck you to corporate medicine. It's a way of saying fuck you to insurance companies. It's a way of saying fuck you to the government. And it's a way of saying I love you to your patients, to the people who work with you, to the specialists you're connected with, and to the tribe of healthcare and the tribe of patients and the tribe of humanity. That's what it is. Let's be entirely clear. I didn't mean to go on this fucking crazy rant, but I no longer give a fuck. I think I mentioned that. Let's read some comments. Callie, or business or practice owners want us to quickly turn over patients and see them in 15 minutes and chart during that short time. Most of my burnout and ethical dilemma was about hurrying discussions. You're absolutely right, Kelly. When you're forced to rush, listen. I often do speaking for large companies, and I'll sit on these calls sometimes, and sometimes the leadership is so woke that you get goosebumps. You're like, these are clinicians. These are people who care about the patients. They're trying to inspire their staff. This is a beautiful thing. I had an example of that at Stormont in Kansas. And then sometimes you get on calls and you're like, these people are the problem. Like, I'm getting angry listening to this person talk. And I go into those talks and I'm like, I'm not talking for the leadership here. I'm talking for the physicians and the nurses and the techs and the pharmacists who are here to see this, and I am not gonna pull my punches. And believe me, when I leave, usually the leadership's just like, and usually the audience is like, fuck yeah, standing up. And that's what we need, is we need voices to stand up together. We need us to stand up together, because individually we get punched down. By the way, no one can fuck with me now because I'm not beholden to anyone. So I'm willing to scream and yell on your behalf, right? And it may mean that I don't make any money for the rest of my life, but I just don't give a fuck because my wife's a radiologist, right? She doesn't make a lot of money either because she's academic, but still, we can survive, all right? I worked really hard most of my life to save money. And that's just the nature of it. It took years. And now I'm like, you know what? And with the supporters on Facebook, we can run the show. We don't need anybody. The more supporters we get, the more cool stuff we can do. But even at the level we're at now, we can run this show into perpetuity without taking a dime from any motherfuckers. It's amazing. All right, let's see. Hitchhiker, you're not a doctor anymore? Oh, fuck you. Yes, I'm a doctor. I hate it when people say that shit. I see patients, I'm adjunct faculty at UNLV. I see patients at our county hospital with house staff. Do I do it every day? No. Do I get paid for it? No. Am I still a doctor? Fuck you. Yes. I'm so tired of people trying to shame physicians who do years of clinical work and then decide they want to go into leadership or they want to do something else to try to take the career to the next level because they feel like they can do more good on a daily basis doing that than seeing patients every day. I can help more patients by helping caregivers, providers around the country, and by changing the conversation than I can by sitting in a hospital and admitting a pneumonia. That's just a fact. And it took a long time for me to get over the sort of guilt of not being a full-time practitioner because motherfuckers will shame you all day. Fuck you. I should shame you motherfuckers for sitting in a job you hate where you're morally injured every day and doing nothing about it except for bitching, complaining, drinking, getting depressed. Wake the fuck up. And again, I'm not trying to shame you. I'm just telling you, yeah, I am trying to shame you. If we give up our locus of control to others, we are forever a motherfucking slave. And believe me, I was there. I was a slave, especially the last 2 years of my practice at Stanford. I was a goddamn slave to corporate medicine. Sutter Health, they were my slave masters. And it just got worse and worse and worse and worse until I said, fuck this. I am worth more than this. I'm a better person than this. I'm a good person. Why am I forced to do bad things? Fuck that. We have to wake up in our own way. For me, it was doing what I do. For you, you have to answer what that is. Fucking A. All right, let me see here. Callie, I was a slave and then said no more by moving to another state after marrying a Navy man. Hell yeah, Callie. I like your style. Let's read some comments. Do you think the magnet program is on target? Lori Silva. I've heard mixed things about magnet, Lori. I'm very, 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 very skeptical of organized certification programs because I feel like somebody's got some skin in that game. Somebody's making money based on these things. Like, for example, maintenance of certification for Internal Board of Medicine. It's a scam. It's a money-making scam. It has no causation in making better doctors. There's got to be a better way to police ourselves than spending thousands of dollars and doing a ton of busy work when we already have so much shit that's burning us out. Why the fuck should I pay, what the fuck is his name, Robert Barron, who makes like $300,000 or $400,000 a year as the head of this organization, just to fuck us in the ass with stupid tests that don't do anything. I like this comment. It just says fag. That's awesome. Let me see what I can do about that. Hide user from channel. Bye-bye, fag. Guy who says fag. Oh, he said it quite a bit, too. Thank you to physicians and pharmacists who are advocating for their patients and their profession. We need more patients to get involved. Patients before profits, yes. So patients need to have a voice. Now, the thing is, they need to have a voice in collaboration with caregivers. Often it's an antagonistic voice because patients are pissed, understandably so. So, the whole e-patient thing has a mixed bag because some patients are just angry and want to burn it all down. But the thing is, we need to work together in order to make it happen. Let's see. Don't you love streaming on YouTube, Anthony Venturas? I actually do, Anthony. I think it's a lot of fun because I get to just go off the rails. Melissa Big Mac, I like your name, Melissa. I work healthcare partly to get better catastrophic insurance. Don't take it away, please. Right, well, this is the thing. I think we should give everyone catastrophic insurance. Why should we have Americans going bankrupt for medical bills? It's dumb. And you know what the best part is? A lot of times they're medical bills that are unnecessary. So Tom's dad had prostate cancer, got just reamed by the oncology industrial complex, doing all kinds of unnecessary shit. He was dying. Everybody knew he was dying, including the doctors, but they tortured him with more expensive treatments at the end of his life, preying on his hopes. And Tom has talked about this. And now Tom doesn't trust doctors, and he shouldn't, because doctors are fucksticks if they do stuff like that. But it's how we're trained, it's how we're conditioned. No wonder the e-patients are mad, right? Let's read some comments. Great trip about compassion versus empathy. I've read Bob Arnold talk about this from Vital Talk. Yeah, so compassion versus empathy, it's another talk I've done. You guys should just search it. Compassion is inexhaustible. Love in the face of suffering, a detached and concerned love, not feeling another's pain as your own, which is affective empathy. That can burn you out and make you make stupid decisions. Let me go back to some earlier comments here and see what we have. Sharon Rollins, this is absolutely the greatest solution I've ever heard. I'm a nurse and I see exactly what you're talking about. Commercialized healthcare becomes Walmart shopping, and we all know what damage this is. Okay, so here's the thing about Walmart. So Walmart's built this new clinic. They have transparent pricing that's clear. You can pay out of pocket or you can bill insurance. They provide specific services, and they do it in a team-based way with a convenience. I'm actually all for that. Now, I don't know what it's like working for them in terms of being a doctor for them, but I can say that if they can pull that off, they will fix medicine for us. And corporate medicine now works. But they could also fuck it up severely and make it, completely monotonous and destroy the culture of medicine. I actually don't think so. I think we need innovative private solutions. Direct primary care is one of those. Let's see. Sickest thoughts. You mentioned you're loaded. Who the fuck said that? Sickest thoughts? I said, with my wife working, with our supporters, and with money that I've saved, I'm not going to be out on the street if I say fuck you to people that want to give me money to say speak or to sponsor the show or something like that. So I don't give a fuck. In other words, I'm in a position now where I no longer give a fuck. 3 years ago, I might have given a fuck, right? Because let me tell you a little secret. If you don't manage your shit right, if you're actually making income and you're farting it away buying cars and bullshit and stuff, and then you're complaining that you can't afford shit, fuck you. You fucked up. You need to learn how to manage your finances. They don't teach you that in school. That's the problem. That's another talk we got to do, is managing money for medical people, because medical people are stupid at it, guilty. I've made terrible mistakes, but then I learn from those mistakes. If you don't take your own personal responsibility to learn from that stuff, you are screwing yourself up. What's up, girl?
What do you call a wasp when they're fat?
What do you call a wasp when they're fat? What?
Obese.
Obese.
Bees. Puns. Okay.
That was very punny. Also, wasps aren't bees. They're more related to ants than bees. Let's see where we're at. Sickest thoughts. I'd leave the kids out of this, hun. Well, if you even talk about my kids, you get banned. Bye-bye. In a non-good way. Cynthia, empathy is the core of the BSN that they're making me do. 20 years as an RN plus 3 other degrees plus my nursing one is not equal. Well, then fuck them, Cynthia, right? I don't know. William Bustos, wasps are mean. Hell yeah. White Anglo-Saxon Protestants, meanest people in the world. Parenthood 2, non-Deb 63. Let's see, you need a moderator, says Hitchhiker. Yeah, probably. Next time I'll have Victoria moderate. She's not here because it's Saturday. Natosha Nicole, I think we need to do a better job of educating people younger on factual information regarding health. Pseudoscience is rampant in America, affecting public health in multiple ways. Just a thought. Yeah, that's what I try to do on the show. That's why we do things like why is alkaline water a stupid fucking thing to do? Why is anti-vax a terrible idea? All these kind of things, right? So we're gonna keep doing that. All right, guys, I think we did a shit ton. I can't believe we have 130 viewers. Should we continue or should we stop? Let me know, because I can stop, because I want people to actually watch us on the replay too. Magnan Imus, how do we get this message to the mainstream consciousness? We can only talk so many people face to face. Okay, well, that's why we do this show. That's why here's a call to action. I need you guys to share these videos with people that you think will appreciate an unfiltered approach. We are already on the back end talking to politicians. We're gonna have politicians on the show. We are going to infiltrate the mainstream consciousness in a way that we haven't consciously done before, because we were trying to influence healthcare practitioners. Now we're gonna try to influence anybody who can make a difference in all of this clusterfuck that we call medicine. That means people who don't mind a few F-bombs, people who want to hear it unfiltered, people who want to actually contribute to the solution, all right? By the way, if you want to contribute on a financial level, don't worry about it. But if you want to contribute on a financial level and get something in return, become a Facebook supporter. If you want to contribute on a financial level and get nothing in return, except for CME on select episodes, become a Patreon supporter at whatever level you're comfortable with, and we really appreciate it. But the best way to support us is just to share this shit, tell people to subscribe, and hit the little notifications thing so they get notifications, whether it's on here or on Facebook or on Instagram or on Twitter, whatever. Just do that, and that helps us a shit ton. Yes, Todd Yeomans, that is my pimp coat from Readmission on the rack. And Super Chat, Cynthia, is another way to support us. Again, I don't like to beg for money from you guys because I think it's crass as fuck. Lauren says yes to having politicians on. Yeah, so I'm gonna have Stephen Pan, who wrote the anti-vax bill, the pro-vax bill in California, on the show in October. I'm trying to get Andrew Yang on the show. I'm gonna get some conservatives on the show. We'll get everybody on the show. All right, I think we did stuff. Thanks for joining me on YouTube. I hope you guys are enjoying the sort of cross-platform thing we're trying to do. I love you guys. I really appreciate that you joined me for this. I'm inspired by your passion around this stuff. I like seeing trolls on here because it means we've arrived and we can fuck with them too. So let's enjoy each other's virtual company. Take a weekend, take a screen-free Sunday, unplug from anything. Enjoy your family. If you're lonely, if you're disconnected, find somebody. Go volunteer, go get out in the world, because loneliness kills people. Just did an excerpt of our interview with this 19th Surgeon General, Vivek Murthy, a lovely human being, about the terrible epidemic of loneliness. All right, guys, I love you. Let me figure out how to stop this thing. And bye-bye.